Welcome to Athletic Wise, where like-minded people come to connect. We focus on sports science and how it relates to the sports we love. In today's edition of the High Performance Speaker Series, we will be discussing the use of smartwatches for pre-symptomatic detection of COVID-19. Today's guest in the High Performance Speaker Series is Dr. Michael Snyder. Dr. Snyder is chair in the Department of Genetics at Stanford University, is also director for Center for Genomics and Personalized Medicine. Dr. Snyder, thanks very much for agreeing to be interviewed by Athletic Wise.
Thanks for having me here.
So just to give listeners some context, in your recently published article in Nature, your research from a cohort of nearly 5,300 participants used Fitbit wearable technology, and you analyzed data from 32 individuals infected with COVID-19. The algorithms for this detection involved heart rate, activity, and sleep time, correct?
Correct, yes.
Okay. So the algorithms that you're using would likely be able to detect the alteration in physiological metrics that were incompatible with an individual's activity level. For example, if you do a very hard workout, you expect the resting heart rate to be up. But if there was a sharp increase in resting heart rate without, concurrent activity, would that sound an alarm?
It will, yeah. So basically the way it works is when you get sick, your resting heart rate goes up. And what's pretty cool about it is it turns out it goes up in advance of symptoms. So for most viral infections, we found it goes up about 2 days before the symptoms appear. But for COVID-19, it actually turns out it appears 4 days before the symptoms appear. And in some cases, as many as 9-10 days before it appears. So we think that's a big deal because if you can detect, your heart rate going up, it certainly says there's a sign of stress going on, something's up. And there's a good chance in the current pandemic that it's an infection. And so that would alert you to get tested, maybe, self-isolate, don't go around and affect lots of others. So we think it's really, really powerful to stop the asymptomatic spread of COVID-19.
That's excellent. So that being said, would you say an athlete may have to be more cautious these days not to dismiss physiological signals such as an elevated resting heart rate, and attribute it to a workout?
We would, yeah. So we'd have to be a little careful. Now, the way the algorithms are set up, we actually train it on an hour by hour basis. So, and people tend to have pretty regular patterns, including athletes, as I'm sure you know. So what we do is we try and figure out people's normal patterns, and then we look for something abnormal over that. So we don't yet know. Athletes may turn out to be a little bit tricky, and this is why we'd love to get their data, because it's possible. We do know that marathon runners, for example, their heart rate will be up for several days afterwards. So we have this alarming system that goes off when your heart rate's up for a while. And so what it means is if you run a marathon, the alarms will go off for the next 2 days. And it's not due to you being ill, it's just due to this extended, as you point out, resting heart rate that's elevated. So you do have to contextualize the information a bit.
That's excellent. So the use of wearables for viral detection has massive potential to just drastically slow the spread of COVID-19. It also has distinct advantages, such as being cost effective and it's non-invasive. What's your recommended protocol should an individual receive an alarm?
Well, I would think they would self-isolate. The first thing you do is you'd reflect and say, well, there are several things that can trigger this alarm. One is an overly stressful workout might last longer than usual. The other is, it turns out, alcohol. Now, a few drinks won't do it, but if you had a pretty serious binge drinking night, your heart rate will go up for quite a while, and that might be enough to trigger our alarms. And it turns out that actually very, very long flights, not short flights, but long flights, like if you fly to Australia, something like that, your heart rate goes up because the pressure in the plane's lowered, and then your heart rate goes up, or going to high altitude. So if you were hanging out in Denver for a few days, that one's maybe yes, maybe no, it'll trigger the alarms. But I know if you go higher in the mountains, even if you're not working out, that will trigger alarms. So there are things. So the first thing you would do is contextualize. So, well, I'm at high altitude, or I drank too much last night. That's probably what's triggering it. But if you're just doing your normal thing and these alarms are going off, there's a good chance you're coming down with something, or you've just got some other personal stresses going on. That's a possibility too.
That's great. So it's been reported that 50% of positive cases are asymptomatic. Do you believe the algorithms you're using may have the potential to detect positive asymptomatic cases?
We haven't shown it for COVID-19, but I think the answer is going to be yes. And the reason I say that is for other respiratory viruses, we've shown that is the case. We can see cases where people's resting heart rate was elevated, they were asymptomatic, and then we test them, and it turns out that they're elevated for a marker that says they've had a viral infection, for example. So the marker is called C-reactive protein. So, and that's fortuitous. We found that. Now in the era of COVID, athletes are getting tested a lot. So there's a decent chance we could correlate this better and see, exactly when the resting heart rate goes up relative to their showing up positive. And if they're asymptomatic, there's a good chance too, we can pick it up because they are getting tested a lot.
So for the infected individuals in your study, did you collect data on their recovery, like their return to baseline?
We did. And one of the things you learn about COVID is actually, it seems like there are more lingering signals, so to speak, as though there is some physiological stresses, if you will, that are lingering, and that is known to happen. Unfortunately, with COVID, it does seem to have some longer effects than your typical respiratory virus. And in some cases, those can be really quite extended in older individuals, particularly or those with underlying health conditions. They can actually, they can have severe issues that can last for months, and we don't even know how long in some cases. And we do pick that up with the smartwatch. In some individuals, you'll see these recurrent signals that are occurring after the main infection. So I do think in some cases there are these lingering effects. We'll see it. And we don't yet know if we can predict who's going to have them and who doesn't. We need more data for that.
So we're trying to encourage athletes, obviously, to continue training. And, the athletes I work with do have pretty intense workouts sometimes. And I advocate that, high intensity training. But, that period right after a very hard workout, they are more vulnerable. So I tell them, within 2 hours after your hard workout to be, extremely cautious. Any thoughts in that regard?
Yeah, I mean, I would agree with you. I think when you are hyper stressed, you are, your immune system, to be honest, in the case of athletes, they're repairing their muscle and things. And so there is a greater chance, presumably, of getting viral illnesses. I think what we could do, we haven't done this yet specifically for athletes, but we could train our algorithms a little bit better too, to actually, take into account that after a really strong workout, maybe we would extend the period of not sending off alarms. So I think there's things to be tweaked. But I think athletes are particularly important to be measuring this way because you probably know they're one of the most vulnerable groups to be actually getting illnesses because of all the contact, especially for many sports. And in fact, I just learned today that something like 10% of NBA players are actually COVID positive going into the new season, which is a pretty high number when you think about it. So I think, and also the other thing about athletes is, if you're starting to get ill and you may not realize it, you're more prone to injure yourself. So actually early detection, I would argue, is even more important, not just for stopping the spread for athletes, but also to prevent injuries, because you wouldn't want someone to be, operating at 80% capacity, and that leaves them vulnerable to, as I say, hurting themselves. So
yeah, very good point. So currently the technology works with Fitbit and likely in the future with Garmin, Apple, Polar. Do you recommend individuals, especially during this time, to continue collecting their metrics regardless of their device, and possibly you could use the data later?
absolutely, yeah. So we are trying to collect the data from some of these others, and some companies have been a little bit easier to get the data from than others, but we are hoping to work with all of them. And so that is the plan. So absolutely. So if you have your favorite device, I would argue sign up for a study. We can't alarm you just yet because we don't have the algorithms trained for that, but we could collect the data, and that will help us perfect the algorithm so that hopefully in the near future, we can set up an alarming system for all of these different smartwatches.
Oh, that's excellent. So recently there was a study published in PLOS One that involved a cohort of 95 individuals in France, like during confinement. So it was over a 3-month period, and 80% of the individuals had a deterioration in wellness over that 3-month period. So researchers used HRV parameters along with subjective measurements. And the HRV metrics were in line with wellness responses. So this is another example of data that can be captured with wearables that has the capability of early pathogenic detection. Is that a metric you might look at in the future?
Absolutely. The only reason we don't have it in there now is that we haven't been able to pull the data from Fitbit. We haven't yet set up a way to get that data from them. So that is an issue, but that's in the plans. And there's actually other metrics that are going to be pretty important too. So you mentioned heart rate variability, but there's skin temperature, there's actually respiration rate, there's your blood oxygen, believe it or not, you can measure from a smartwatch as well. And with some devices, you can even measure blood pressure, believe it or not. So we want to collect all that information and then actually train, let the data tell us which signals are most informative for actually early detection. My guess is it's going to be a composite signal. And if we're lucky, we might even be able to tell the difference between COVID and other kinds of viral infections. I do suspect we'd be able to tell the difference between, say, a viral infection and say alcohol or some of these other things as we collect more data types. So I think we're just at the beginning. And I don't think it's going to take that long. As soon as we can get these other data types to improve our algorithms to be even more sensitive and more specific for detecting the kinds of events we'd like to do early detection on.
Yeah, so obviously fine tuning those algorithms require a lot of data. So we want to encourage everyone to download the app. So can you direct individuals?
Yeah, absolutely. So please sign up for a study. It's innovations.stanford.edu, innovations.stanford.edu /wearables if you want to go right to the site. And that, or just search Stanford wearables and you'll probably find it too. And so all you have to do is download the app. You do have to sign a consent. It's a research study, which you can do electronically. And then we'll just ask for your symptoms and off you go. It will, if you have a Fitbit, we'll start alarming you. If you have other devices, we'll pull in your data. We can't yet alarm you, but I hope we will soon. So we also need some baseline data, by the way. We need about 28 days of baseline data to know what your normal patterns are. Because what we're trying to do is find that elevated signal, this abnormal signal over your normal background baseline patterns.
Oh, that's wonderful. Yeah, that was my next question. How long a period? So about a month prior.
Yeah, that's right. So 21 to 28 days. I mean, we can do it less, but we prefer to get it that long. That gives us a pretty clear signal. And I do want to emphasize it's not perfect too. We pick up these signals 70 to 80% of the time. So we do miss some cases, but we think we know in some cases why we miss them. The people with severe allergies or on medication, we have a hard time getting a stable baseline on those. So picking up abnormal signals, that's not true for everyone, but for some individuals who that is the case. So we're trying to, perfect that as well. I think ultimately we should be able to detect this on everyone because when everyone gets sick, their heart rate does go up.
No, the initiative is fabulous, and I think it's painless as well. And with so many people using smartwatches, I think it's absolutely brilliant. So yes, we're going to definitely encourage everyone to download the app, and it's the collective process can certainly help the current situation. So thank you very, very much, Dr. Snyder. I think that was tremendously helpful.
Thanks for having me. Yeah, please do sign up.
Okay, really appreciate it.